The world is going on to 100 million coronavirus cases with about 55 million recoveries. There have been over 2 million deaths. Iran is one of the hard-hit spots on the globe with 10 cities in the red. However, its toll has been reduced to a fraction of what it was. As of 25th January 2021, there were 1.37 million registered COVID-positive cases in Iran. Of these, there were 1.16 million recoveries and 57,294 deaths. US sanctions and a strained economy have meant less than average fiscal space and therefore a partially haphazard set of restrictive protocols in place. It's a wonder how Iran has managed to bring its coronavirus death toll down to a fraction of what it was. That's from 400-500 deaths a day to 70-80 plus deaths a day. Now, why and how has Iran set itself on this steep path to survival is our question. Iran has even attempted manufacturing an anti-corona vaccine, or let's say vaccines. More to follow. Stay with me, Leila Faramarzi, on Iran Today. More than 8 Iranian companies and universities are currently working on a COVID-19 vaccine. And Iran launched human trials of a first domestic COVID-19 vaccine candidate of its own late in December. But vaccine production or administering is not the primarily important step in corona control. Dr. Abul Qasemi, Dean of Baqiyatullah University, explains.
کنترل بیماری هنوز
Controlling the disease and breaking the virus transmission chain is the most important task we can do to take the outbreak under control, which has several requirements that must be met. The most significant of which is that people observe social distancing, using face masks, and adhering to public health guidelines. Thankfully, measures have been taken in the country in the past few months that have raised awareness amongst the people, and as a result, the new wave of the disease was brought under control.
I said earlier that restrictive measures had been haphazard. Well, that doesn't hold for all waves of the pandemic, which is why Iran finally got results. Dr. Qanei is a lung specialist involved with the Corona Combat Unit and bringing vaccines to fruition. Iran's past protocols in controlling the spread of the coronavirus. What would you say are the strengths and weaknesses of those protocols?
We passed the first and second waves by issuing lockdowns and preventing people from going outside their homes. But we acted smartly during the third wave by dividing cities into different zones and imposing travel restrictions based on the condition in that specific city. We monitored people's cell phones, enabling us to prevent those who had contracted the disease from traveling. The airports are now being checked, and we have been increasing the number of coronavirus tests to several thousands. Our testing capacity was dramatically increased. The combination of these measures, namely early detection, isolation, and intelligent quarantines, helped us to rein in the disease.
Iran established a National Electronic Health Record (EHR) system in which every citizen is registered with a national ID number. That helped health networks start early detection of infected cases. Afflicted citizens could thereby be isolated. The most vulnerable were prevented from referring to hospitals in cities. Rather, health teams were assigned to visit patients at home. As for prevention, impoverished suburban residents reportedly had masks distributed to them. Dr. Mardani, a specialist from Mehr, a most prominent hospital in Tehran, joined us on Skype. Do listen in.
الان خوشبختانه We were able to control the disease in the country. Fortunately, the number of the cases is now very low. The number of new patients has actually reduced to a third or a quarter of what it used to be. Our hospitalization have dropped dramatically. We have closed many COVID-19 wards in university hospitals and those belonging to the Ministry of Health and the Army. Our ICUs, which had no empty beds to receive COVID cases, are now accepting other patients. However, some hospitals still house coronavirus-positive patients.
Iran is one of the top 5 manufacturers of coronavirus antigen-based rapid detection kits in the world. And it rapidly established a decentralized laboratory testing for COVID-19. The homegrown antibody rapid test can detect coronavirus in 15 to 20 minutes with over 85% detection power, which is higher than PCR tests. This country has a strong primary healthcare system, and with a production surge in a reasonable time and a multi-sectoral response to the corona crisis, it has achieved some impressive results which it hopes to sustain. On the 14th of January, Iran's COVID-19 daily death toll was reported at 81, marking a 2-digit figure for 2 weeks and the lowest fatality rate in 7 months. To move on to what the future holds in store, the vaccine that is, Shafa Farmed has already cleared animal trials for its vaccine, and it aims to complete limited tests on 56 volunteers in its initial stage. Tests expected to last a month. How does Iran's success rate rank in combating the coronavirus compared to regional states?
در منطقه وقتی شما ردیابی می‌کنید
There are 2 countries that are producing vaccines in the region. One is Iran and the other Egypt. But if you have a look at the UNICEF website, Iran is the only name mentioned as a producer of COVID-19 vaccines. The country that didn't want to have a vaccine is now producing it itself. The other point is that we in the Biotechnology Development Headquarters have supported all forms of vaccines to be developed. So we will have a variety of vaccines in the coming months, God willing.
Here's a list of the most prominent vaccines currently being made around the globe. In the top 3, you see US's Pfizer vaccine and the UK's Oxford AstraZeneca, which Iran found no use for, not even for the 150,000 Pfizer shots the US wanted to donate to this country. Several reasons why. Let's hear it from Dr. Abul Qasemi. His Baqiyatullah complex is making a vaccine of its own and treats corona patients by crisis doctors with experience in war zones.
همین الان یه داروی هست به نام سیکلوفوسفامید.
There is a drug right now called cyclophosphamide. This drug also happens to be produced by Pfizer. You cannot find the vial of the drug in Iran. I wonder how Pfizer, which failed to provide us with cyclophosphamide because of the US sanctions, has become kind enough to give us the vaccine as a gift. This proves they're politicizing the matter. That is, they first put pressure on a nation and refuse to provide it with food and medicine, and then give out a gift to whitewash their crimes. We should not be fooled by these things. We have been accustomed to this behavior for years.
Moderna and Pfizer vaccines were never on the agenda to be purchased by Iran anyway. This is due to their high prices, transportation problems, and the need to be kept extremely cold. This is according to Mohammad Reza Zafargandi, head of the Iranian Medical Council. Iran deems its homemade vaccine to be more reliable than many foreign-made vaccines, but it takes a long time to be approved. So this country plans to import some 2 million doses of COVID-19 vaccines from India, China and Russia by the end of the current Iranian calendar year, beginning March the 21st.
We on the vaccine committee know that vaccines and drugs are produced differently. When buying a vaccine, you must ask the manufacturing country to produce it for your country specifically. It is not like you go on, and take the vaccine from the market. Each country has its specific vaccine and with its own production number. You cannot get this vaccine from anywhere else. It is specific to that country. What the leader of the Islamic Revolution has said in his remarks was that we don't trust Britain and the United States in what they will produce when you place an order. This is a bigger issue and has nothing to do with the types of vaccines.
نوع واکسن ارتباط نداره.
More than 60,000 people signed up for the Shafar-Fomet trial vaccines mid to late December. Several other Iranian vaccines are expected to clear animal trials by late February.
واکسنی که دانشگاه علوم پزشکی بقیت‌الله کار کرد.
The vaccine that Baqiyatullah University of Medical Sciences worked on is a recombinant type. We hope that it will reach the human trial phase by March. We are now in the animal phase. The vaccine has been tested on monkeys and given very good results. It was previously tested on small animals such as mice, which also had very promising results. We hope to be able to successfully prepare the vaccine and pass the human trial phase.
Time for a short break. We'll be back in no time. How Iran's faring in the meantime, I leave to after a quick media review. So let's move indoors to see what other media outlets have to say. To begin the news section, let's look at Tasnim news, the coronavirus and travel bans. Iran extends coronavirus travel ban to UK. Iran has extended the suspension of flights to London over concerns about an alarming surge in the coronavirus cases and a new COVID variant in the UK, an official said. Head of Iran's civil aviation organization, Turaj Dehqani Zangane, told IRNA that the ban on flights to and from London will remain in place until February the 18th. Iran began to halt the UK flights in December 2020 to prevent the spread of a new coronavirus strain that was first reported in Britain. Moving on, the WHO puts in a word on Iran and its corona crisis. In the Middle East, COVID-19 hotspot Iran, WHO walks the talk. An obstacle that Iran has had to face in its COVID-19 response is unilateral economic sanctions, which are also affecting the health sector, even before the epidemic started. While the WHO country office, together with other agencies of the UN country team, are supporting the Ministry of Health and Medical Education to mitigate the impact, even the timely implementation of more than $80 million which the country office has received for COVID-19 emergency procurement for life-saving medical and laboratory equipment from a range of different donor countries and the Ministry of Health is made more difficult under such conditions, in addition to the anyhow stressed global market conditions with much higher demands than supplies. WHO supports the country by directly communicating with suppliers and purchasing state-of-the-art equipment and essential supplies on the global market. Tehran Times points to the reliability of Western vaccines. Western COVID-19 vaccines, an iron fist and a velvet glove? According to the World Health Organization, WHO, currently more than 230 pharmaceutical companies around the globe are working to develop the corona vaccine. And more than 30 million vaccine doses have already been administered in 47 mostly high-income countries. Meanwhile, 4 drug giants have grabbed the headlines: Pfizer, BioNTech, Moderna and Oxford, as well as fierce controversies surrounding the safety of their products, possible adverse effects and efficacy, let alone some lawsuits against them due to their products. As stated by the Wall Street Journal, France now meets some of the world's highest skepticism rates, with only around 422,000 people receiving the vaccine in more than 3 weeks since European regulators authorized the drug, far behind most other developed nations. Also, approximately 4 out of 10 Americans say they would definitely or probably not get a vaccine, according to a Pew Research Center survey of 12,648 US adults from November the 18th to 29th, 2020. Thanks for staying with me. Back to our own narrative now. Still in waiting, Iran reached an agreement to pay for 16.8 million doses of vaccines from COVAX using its central bank's funds in South Korea. $7 billion, that is. But a day later, it decided against that for fear its money would be seized by US intermediary banks. Instead, Iran attempted buying 1 million doses of a vaccine from China, said Karim Hemmati, the head of the Iranian Red Crescent Society. COVAX, by the way, is a global initiative under the World Health Organization, WHO, that aims to ensure equitable access to vaccines for all countries. Now, reports came out in early to mid-January on an inspiring joint effort that Iran and Cuba had begun trials of a joint COVID-19 vaccine. The two countries, both of which are suffering illegal US sanctions, decided on a little self-help to turn the tables round. And Cuba's Soberana 02, the most advanced of Cuba's 4 vaccine candidates, was set to be developed in cooperation between Cuba's Finlay Vaccine Institute and Iran's Pasteur Institute. The last stage of clinical trials of the Cuban vaccine are to be carried out in Iran. Technology transfer and joint production were preconditions for allowing human testing in this country.
The vaccine Iran and Cuba are working on has a feature called recombinant DNA technology. We first collaborated with Cuba about 25 to 26 years ago to transfer the technology to make the hepatitis B vaccine. Since 1993, all people born in the Islamic Republic of Iran have been vaccinated against hepatitis B free of charge. Now, this Cuban vaccine, in collaboration with the Pasteur Institute, has the same DNA recombinant technology, which will undergo clinical trials in the near future, God willing.
Amid concerns over a 4th wave of the pandemic, Iran's race for a homegrown vaccine continues. In the meantime, however, it plans to carry out a national anti-COVID-19 vaccination scheme in February, with imported vaccines as well as homegrown ones. The question is, in what order? Iran has a 4-phase plan in place to prioritize vulnerable groups. The Corona Combat Headquarters spokesperson stressed vaccination will begin before year-end in 4 phases, the first 2 phases of which will reduce the death toll. Iran has made software connected to the Unified Health Network. It will pinpoint exactly how many vulnerable groups exist in each province and city, and how many vaccines they must receive. Another software program has also been developed for people to enter in their age, occupation, and background illness, to see in which phase they can get their jab.
وقتی شما واکسن رو دیولپ می‌کنی بعد میشه تولید انبوهش. ما این چیزا رو پیش بینی کردیم.
After developing the vaccine, you'll get to the mass production phase. We anticipated this and investigated the facilities we can use in the country to be able to mass produce the vaccine. There's a vaccine which we can make large numbers of and make it available to the public by June. We also believe that we can prepare more than 1.5 million doses per month of the recombinant DNA vaccine.
The first phase will see the following groups vaccinated: health workers in direct contact with the corona-infected, care home workers, chemical warfare victims, and war veterans with respiratory or over 50% damage. Also, undertakers and the mentally and physically frail are in the Phase 1 category, which covers some 1,300,000 people.
We are a country where we vaccinated against polio in a way that the world did not believe, when we managed to inoculate everyone in 1 month. In other countries, a maximum of 700,000 people are vaccinated per week. If we want to proceed at the same rate in Iran, 10 million people could take the jabs. which is far fewer than the 80 million people living in Iran.
Phase 2 is to cover other high-risk groups such as over 65-year-olds and those with background illnesses from age 16 to 64. Phase 1 and 2 vaccinations are to reduce the death rate, but with phases 3 and 4, hopes are that the spread of the virus will come to a halt. The viral chain will be broken, that is.
Fortunately, Iran was introduced as a model in the Middle East in terms of transparency of case reports in the last meeting of the World Health Organization in the Eastern Mediterranean region. I'm confident that cases in the UAE, Saudi Arabia, and countries including Iraq and Afghanistan are much more than in Iran. But either some of these countries, like Iraq and Afghanistan, lack the ability and facilities to accurately detect and report cases, or some like Iran's southern neighbors in the Persian Gulf, who have the capabilities, intentionally choose not to announce the data.
As for Phase 3, that is to cover densely populated centers such as barracks, prisons, winter shelters for the homeless, immigrant camps, transportation personnel, teachers, bank employees, and anyone at lower risk than the Phase 2 group. Finally, Phase 4 will cover the general population. Although Iran has a good health network, it has furthermore foreseen vaccination stops in 400 hospitals, as well as equipping 4,000 local health centers and homes for an evening shift and vaccinations. It all sounds so easy in words, but the path to reducing the death toll and attempting a vaccine has been a rocky road. Our doctors tell of some challenges the country and its medical workers faced.
Imposing restrictions poses enormous challenges in any society. The first problem that arises is economic issues. When you order that the markets must close at 6 p.m., the shopkeeper may not be able to even afford the rent. According to the official information published by the Statistical Center of Iran, gathered from across the country, people's main sources of income over the past year were either from renting their houses or interests they received on their bank deposits. That is, most businesses have run into problems in the past year. Unfortunately, the government has been unable to pay for damages inflicted on Iranian families due to the sanctions.
Another challenge with imposing restrictions that Dr. Mardani told us of was that a lot of people took the disease too lightly and had it spread in their families. In hospitals, we got to see families who took precautions for 8 months, he said, then suddenly thought, what the hell, and took off for Mashhad city. And well, they all caught COVID-19. Thank God for the medical front. I asked how Iran had managed to replicate secret formulas in devising its own medicine.
ما از نظر علمی دانشگاهامون و دانشکده‌های داروسازیمون و
Our universities, pharmacy faculties and biotechnology systems that were developed after the Islamic Revolution are unique. We may be amongst the top 10 countries in the world in terms of drugs and drug development, especially biological drugs. So we do not need to have access to a secret formulation. Many of these are now shared in the world. It's not like the formulations are being kept a secret. When a drug is made, it has a formulation that our scientists can find and access. So far, we have done this like other countries. The Indians and Chinese have done the same.
Moving forward isn't necessitated by modern technology. In bringing the past forth to the rescue, Iran decided to dip into its ancient tradition of herbal cure, this time for a very new disease. And 85 research projects on traditional herbal medicine were developed to help contain the coronavirus pandemic in this country. Arman Zargaran, an advisor to the Traditional Medicine Office of the Ministry of Health, said that some of these medicinal herbs were even able to halve the hospitalization period and help patients recover faster. Also, to reduce the burden of the disease, a center offering traditional medicine services to coronavirus patients was inaugurated in Tehran's Shahid Beheshti University of Medical Sciences. This happened early in November. That's it for today. Thanks for watching from the whole team. Do remember to tune in again at the same times next week and each week after, and to leave your comments and topic requests. For now, I bid you farewell with well wishes and high hopes for coronavirus patients now that vaccines are lining up.